Antineoplastic Drugs lecture. Cancer is caused by disorderly, uncontrolled cell division. Metastasis is the spreading process of cancer cells from one part of the body to another. Proliferation is a process of rapid production. Treatment of cancer is a combination of surgery, chemotherapy, radiation, and immunotherapy. Treatment is very individualized based on the patient. Treatment depends on the following: type of cancer, its location, its invasive process, and the patient's state of health. Antineoplastic drugs, also called cancer drugs, are cytotoxic. They kill good and bad cells. They decrease in white blood cells and antibodies, increases immunosuppression. So these patients have a high likelihood of getting an illness such as a cold or the flu or another disease. Chemotherapy is very individualized depending on response, and there are 9 major classes of antineoplastic drugs. Patient evaluation, laboratory tests and scans are done to determine the best treatment plan and exact diagnosis. Lab tests are particularly important for baseline before initiation of therapy to measure response. Some of these tests are, but are not limited to, platelet counts, CBC, hemoglobin, hematocrit, CBC with differential, and liver and kidney function. Care of chemotherapy patients. Communication is very important among our chemo patients. Oftentimes they are coming in for treatment quite frequently. Identify nausea and vomiting earlier. Zofran may be necessary. Diet changes. We can also suggest to the patient to decrease the nausea and vomiting, decrease in spicy or greasy or acidic foods. Avoid unpleasant odors, eat small meals, take Zofran before chemotherapy, suck ice chips, and refrain from smoking. It is also important to educate our patients to stay away from those who are sick. Oftentimes when patients are going through chemotherapy, they will isolate themselves. Also, it's very important to wash hands frequently. Be aware of bleeding and report it, so excessive bruising or petechiae in the skin, it is important to report that to their physician, so instructing patients to do that. Nosebleeds, bleeding in the gums, rectum, and vaginal areas. Very important if a patient has this to instruct them to contact their physician. And alopecia. Vinoblastine is a meiotic inhibitor. Action inhibits mitosis or enzymes that prevent protein synthesis needed for cell reproduction. Most often as a treatment for lung cancer, especially in those who are elderly. Some side effects of this medication are oral GI ulceration, rash or photosensitivity, and neurotoxicity. Antimetabolites. They interfere with the DNA synthesis, repair, and cell replication. We often use fluorosil for skin cancers and methotrexate for resistant psoriasis, rheumatoid arthritis, and lupus. Hormones suppress growth of certain tissues of the body without exerting cytotoxic action. They treat endocrine-related tumors, so breast, prostate, endometrium, ovary, kidney, and thyroid. Non-endocrine-related tumors that it treats is leukemia and lymphoma. Corticosteroids such as prednisone are used in leukemia and lymphoma. Prevents allergic reaction during chemo treatments. We also use dexamethasone that is used to help with nausea and vomiting. It also reduces cerebral edema in patients with brain tumors. Hormones that we use The following are used in antineoplastic therapy, so Premarin, Tessalactone, Depo-Vera, Tamoxifen, citrate, and Lupron. Tamoxifen is used to treat breast cancer in men and women. It may help stimulate estrogen receptors in the bone. It may help prevent osteoporosis. One of the major side effects is hot flashes. Anastrozole inhibits estrogen production. It's an alternative to tamoxifen used in postmenopausal breast cancer patients and will cause osteoporosis. Prostate cancer, the main treatment is Lupron and Casodex, usually given in conjunction with each other. The most common side effects are impotence and hot flashes and pain. Other cancer treatments, we have preventative, the Gardasil vaccination for those under the age of 25. Treatment, Provenge for prostate cancer. There is a vaccine out there, not always covered by insurance companies. Some insurance companies believe it's investigational yet. Combination chemotherapy using multiple drugs to treat a diseased tissue. Surgery, sometimes what they will do is they will use radiation to shrink the tumor, and then they will remove the tumor with surgery once it has reached a certain size. Radiation is the destruction of the diseased tissue by using ionized radiation specific to that type of tumor. Immunotherapy stimulates the body's immune system.